Board of Health is in order in session at this time, and I'd like to ask all to rise and join me in pledging allegiance to our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Does everybody have a copy of the minutes? Take a second or two to review it, and I'll entertain a motion to approve and a second, and then we'll discuss any changes. Motion to approve the minutes. Ms. Wishner has a motion to, Dr. Alford has seconded it. Any discussion of the minutes, changes, deletions? Mr. Fisher.
I have, on page 2, under the liaison reports, I believe it should read that I requested items from the Board of Health in terms of notices and other information that could be put onto the Board of Commissioner agendas.
Okay, that change is so noted and will be made in the final draft, in the final version. Forgive me. Any other additions, changes, deletions? All right. All in favor? Aye. Any contraries? Minutes are approved as changed. At this time, we'll ask Mr. Taltone to provide us with his announcements and his health officer's report.
Good afternoon. As far as announcements are concerned, Dr. Donato, Nurse Genevieve Burns, and Dr. Amy Leader all offered their regrets they could not make it to the night's meeting. And from that point, I'll go on to my my report. During the month of October, we did 5 rental housing inspections, 30 food safety inspections. Unfortunately, one of them resulted in a summary citation for noncompliance with sanitation violations. We had 3 new food facilities that opened up in Radnor Township. Duffy's at 100 Matson Ford Road, building number 1. We had Chipotle Mexican Grill that opened up in the township at 223 East Lancaster Avenue. And we had the White Dog Cafe at 200 West Lancaster Avenue. We had a change of ownership in one of the food facilities, Great Harvest Bread, and we have several others on the horizon. We have a Fabio and Danny's Cafe coming into the train station at Wayne, and we have Zilantra Mexican Restaurant on North Wayne Avenue, also Matador Restaurant, which is coming. Hopefully, we have an inspection tomorrow. Hopefully, we'll get them open tomorrow. We had several quality of life issues. 7 of them, there were 10 of them total. 7 of them were animal related. 1 was a sanitation issue. 1 was a food facility, and another one was a code related issue. Want to bring your attention to the letter that Mr. Herb Hazen wrote to the Board of Commissioners. That's in your packet regarding Chapter 115, requesting the Board of Commissioners move forward with that action. Also, I just want to reiterate the Serve Safe class training that we have, especially for those restaurateurs that are out there, that we will have here at the Township building in this room on January the 3rd, January the 28th, 2011, for those people who require Serve Safe training. Again, the state of Pennsylvania requires that at least one person in every food facility have a person in a supervisory capacity that is certified in food safety. We are pretty current with that. I like to stay up on that in my inspections. I check those routinely, but they do expire and people do move and relocate from restaurant to restaurant. Also, there's an influenza immunization awareness night with the Philadelphia Flyers, Wednesday, December the 8th. That flyer is in your packet. Also, I got it at sort of last minute, but I wanted to forward it on to the Board of Health members. The 2011 Dr. Nathan Davis Awards for Outstanding Government Service. The American Medical Association invites you to submit nominations for these awards, which are presented for outstanding contributions that promote the art and science of medicine and betterment of the public health. The packet, I think, is in your packet. If you want to consider that, I think that probably everyone on this board is probably could be a candidate for that. Finally, I have in the packet, are you ready to quit smoking? Participate in the smoke-free mainline health-free six-session smoking cessation program. These flyers I've had out, hopefully, and people have talked about it when they come into the township building. And I think we have a couple of people in the township that actually took part in this program. One of the classes is tonight at the Mainline Health Center in Broomall. Mr. Chairman, members of the board, so is my report.
Thank you for that report, Mr. Taltone. And again, with regard to the Dr. Nathan Davis, even though the time is short, I would encourage any member of this board to submit a nomination in accordance with their requirements.
Mr. Chairman, I did forget to mention one thing. The drive-through flu clinic that was held on October the 22nd, 2010, at that drive-through flu session, we were able to administer 872 flu shots to Delaware County residents. So I just wanted to mention that.
That's commendable. Thank you very much for that information. With regard to the proposed revisions to Chapter 115 Animal Control, which has now gone to the Board of Commissioners, just in a tentative way, so the board members will know, it's possible that, and I will confirm this via email, that this will come up at the November 22nd, I believe it is, meeting of the Township Commissioners. That will be the first reading of the proposed revisions. The earliest that the Commissioners could vote on that in accordance with established procedures would be 30 days following that time. So again, I will confirm via email that whether or not that item is indeed on the Commissioner's agenda for November 22nd. That meeting will start at 7 p.m. Is that correct, Mr. Fisher?
That's correct.
Thank you. Okay, at this point, I think everyone, I had asked Mr. Taltone to provide us at our places with another copy of Ms. Mosier Mills's listing of teen health issues, which we first reviewed at our last meeting. And we do have some guests with us tonight, so we're going to try and tie that listing in with their presentation. Dr. Andrea Shapego is here tonight to talk about teen health issues and general children's health issues as they affect the kids in our Radnor Township School District. And Dr. Shapego is Director of Student Services and Special Education for the Radnor Township School District. Dr. Shapego, I'll ask if you could come up and introduce your colleagues who are here with you.
Good evening.
Good evening.
Let me first thank everyone on the board for the opportunity to be here and talk a little bit about the health issues impacting our students. I want to sort of give a special thanks to Amy Wishner, because she has been so helpful in liaisoning with us and the community and the board in terms of current health issues. Last year we got to know each other very well with our H1N1. This year we talked about pertussis. Thank goodness it's not quite as bad as last year. But so thank you, Amy, so much for helping us. Let me start by introducing two of the really important people who are here tonight, and I'm going to ask them to come up with me. And that's Agnes Severi, who is our nurse, one of our nurses, and Sue McFarland, who is a nurse at the high school. Agnes and Sue work as co-chairs of the nursing department. So hopefully what we'll do is just a very quick presentation on health issues and also a little bit of information about what we're experiencing in the Radnor Township School District. So we have in Radnor, we're very lucky with our staffing in terms of nursing. The Board of School Directors has been very kind to us in realizing that student health and student safety are two issues that you really can't fool around with. You really have to be very serious about making sure that our students are safe and healthy. We have 5.4. I'm laughing at the 0.4. You see this little 0.4 person, but we have a nurse who works part-time, who's certified, and certified nurses are certified by the state. We're lucky to have our registered nurse assistants who are registered nurses, they just don't have school certification. And we have 2.6 of our nurses as registered nurse assistants. We serve 17 schools in the area because our nurses serve both private, parochial, and our public school. So they have a little job to do, for sure. 3,665 public students and 3,530 private school or parochial school students. We have one physician who is, we say on call or on retainer, and he has been really wonderful helping our nurses with doctor's orders and questions, and really always being available, and that's Dr. Rocklyn Walker. Who lives very close to the high school, I believe.
And graduated from Radnor High School.
And then we also utilize a dentist when necessary, when students can't afford dental care. We divided what we do into sort of big chunks, and the one thing that our nurses do, and the one area where we have to really pay attention are chronic illnesses in children. And so what we did was we took the number of chronic illnesses that we have experienced at Radnor, and I'm going to let Sue talk a little bit about those.
I have to talk there. I have a big voice, so I usually don't need a microphone. But I'm at the high school, and I currently have 5 diabetics in the high school, 4 that are managed on a pump, 1 that uses the injections, tests the blood sugar and gives the injections. And in the high school, these children are pretty, if they've been diagnosed in their earlier school years, are more independent. And they come to tests before lunch every day, and I tend to see problem solving wise is how I see them throughout the day. I have one young man that I work with and trying to help him to be better regulated in school, and we make headway now and then. I attend CHOP has a meeting every year for diabetes in youth, and I attend that because there's always new information that's always good to bring back as you work with the students. I know 2 years ago I had 7 diabetics. That's kind of pretty amazing. That's a lot in one school. We have listed here that we have 11 diabetics in the district. An interesting thing to bring up, and maybe Agnes can speak to that, is the differences when you're dealing with a diabetic in younger school age requires a lot more attention. Do you want to speak to that?
Yes, I work at Radnor Elementary, and this year I have 1 diabetic. I've been there for 10 years, and I always have at least 1 diabetic in the building. I had 2 a few years ago. The diabetics that I've had were diagnosed prior to school age, so they do come into the school with diabetes, but diabetics that are very young age need so much more closer supervision and monitoring. The children usually aren't able to test their blood sugar themselves. They can't assess it and make decisions about what to do. And also, at that age, they're often not aware of what the signs and symptoms of hypo and hyperglycemia are. So they do need close monitoring. We try to cover all bases. At the beginning of the year, we educate all the staff members that are going to be dealing with the children about the signs and symptoms of hypoglycemia. We educate the bus drivers, the cafeteria workers, anyone who'll be in contact with these children, and we do alert the whole staff that there is a diabetic in the building. We are in contact constantly with parents. They take a lot of management. The one student I have gets his blood sugar checked at least twice a day with phone calls home every day, and it's a constant issue. And we're always in communication with the teachers, in communication with the other staff members, to let them be aware. Juice boxes are provided in all the classrooms. Juice boxes are provided to the aides and whatnot. So we do a lot to prepare everybody to deal with it. So monitoring the diabetics at the younger age level is much more time consuming. I have worked in the high school with Sue, and I'm always amazed that they always manage themselves mostly. They do come in for blood sugar checks, but they go out themselves. So it is nice to see the progression. And what we do at the elementary ages, we do try to educate them as the years go by. They start off being very dependent, but they start learning to check their own blood sugars. I have the little boy calling his parents, and they discuss what they're going to eat. They start to learn how many carbs are in foods and what would be good food choices. So it is a progression, and our goal is to educate them to self-manage. So, but it's having a diabetic in a school setting, even if it's just one, is very, very time consuming. So. Go ahead, Susan.
Another issue is asthmatics, and counting numbers that I counted up. I have 161 listed asthmatics. So these are kids that were probably diagnosed very early on. And used inhalers probably more frequently in the elementary school. I know in the elementary school, when I used to sub in the district, there were, all these kids that were identified had their inhalers. Amazing, as they come up to the high school, they're identified with it, not having inhalers, and I do send a notice home at the end of the school year for the coming school year that if your child has it and needs it in school, please send it to us. And of the 161 I have identified, there are 20 that come into my school. There are other students I would imagine maybe are carrying their own, and I may not know. But I would wonder, or I do surmise that many of these students have outgrown the need for it. And although once you've been diagnosed, that we don't have the power to remove that. So I think that number that I have is pretty high. But interesting enough, whether a child has been diagnosed with or without asthma, many times I come upon it during the school year when the weather gets really cold, or in gym classes, the student will come and will tell me if they're short of breath. You'll listen to their lungs and hear some wheezing. So then you will call the parent and suggest that they we make an appointment and have that evaluated, that they may have this reactive airway disease that could be triggered by cold, strenuous physical activity, may only be apparent because of presently have a cold virus that may be affecting them. But a challenge, over the years I've handled kids that have asthmatic attacks. I've had to give an EpiPen and call 911 for them. But let's see, in the last 5 years I have not had such an episode in the high school, so I feel very fortunate. Yes. We do have listed here, as you see up there, 419 students that are identified asthmatic, and that would be in all 5 of our public schools.
I'll just add. As with diabetes at the elementary level, we also spend much more time managing the asthmatics. There are several children that receive nebulizer treatment at school. They'll have an exacerbation of their asthma, and excuse me, having the nebulizer treatments at school does enable them to attend school, and it does cut down on absenteeism because we can give them a nebulizer treatment at noon, and that can get them through the day. So a lot of parents utilize our services that way, and it keeps children in school.
And just in the interest of time, we'll kind of just go through the rest of them quickly. Seizure disorders, we do have students with seizure. All of our nurses do staff developments to make sure that their teachers are aware of what to do in emergency situations. We have 4 students who have relatively serious cardiac involvement, and the school district, from the Department of Student Services, does train people, what we call crisis teams, in each building to make sure that anything that comes up with the students can be addressed. We have about 20 people in each of the buildings and more at the high school who are trained in how to use an AED, how to do CPR, how to do first aid, and actually any kind of restraint training or anything that's necessary, they're trained in that as well. And we're actually just about to train the administrators again. So we pretty much keep an ongoing list of people in the district who can perform emergency cardiac resuscitation, etc. Neuromuscular disorders, we have one student who has a relatively serious involvement with neuromuscular disorders. We also are host school district for St. Edmunds, and oftentimes we find that the St. Edmunds children are very complicated and very involved in terms of physical disability. And what we do for St. Edmunds children is find them places that can adapt their education to their issues. We have 21 students who, over the past few months, have been sent home with head injury, but I'm going to go to the next slide because we talk a little bit about concussion. And we hear so much about it. Anybody who watched the football games this past week, especially the Eagles game, where there were so many penalties because of the head contact, knows that head injuries are very, very serious. And I think in our last 7 months, since September 7th, we've had 26 head injuries. To me, that's high. Either on or off school property, there's 12 accidents. Kids do hit heads on lockers and fall off chairs. So we're very aware that we have to address the issues that go along with concussion. Sleep deprivation and fatigue, we really have focused a little bit on that lately. One of the things when we were doing our strategic planning a few years ago for our school district, we talked about the possibility of changing hours for children, because the older children really tend to need to sleep later in the morning. That's been, research sort of says that it's better for them. Where younger children, and anybody who is a parent remembers this very well, the 6 o'clock, time to start the day. And you're thinking, oh, maybe not. But so, and we reverse it for our children, because the elementary start later and the high school and middle school start earlier. The reason for that, I really believe, is it has to do a little bit, at least, with athletics and sports. So that's something that we're looking at in the school. The nurses do tell me that Monday is a very busy office day. Kids that fall asleep in class, and weekends are hard. It's even harder now for parents to monitor bedtime, because of all the little gadgets that kids could kind of hide under the covers and work through during the evening and night. I'll let you go, Sue, for next.
Well, at the elementary age, we see of the health issues that are presented to us on a daily basis, outside the diabetes and asthma and whatnot, I would say predominantly we get symptoms of headaches, stomach aches, generally not feeling well, and upper respiratory infections. And a lot of this we attribute to fatigue, not sleeping well, not getting good nutrition. But most of the time, children are cold-related, sore throats, upper respiratory infections. So it's a daily thing to deal with it. For us, we're always trying to figure out, are they really sick, or are they trying to get out of class? Do they have a social emotional disorder? Because at the school age, from kindergarten to 12th grade, that's always something we have to consider when we're dealing with their stomach aches. A lot of times stomach aches, I would say predominantly, don't you think, Sue, are more emotionally, socially related than the other ones? So those are probably our primary complaints that we see on a daily basis. And like I said, we're always trying to decipher what is the real cause. Is it really, are they really ill, or is there some kind of social emotional component? So.
The community health issues, we talked a little bit about H1N1 last year. We deal with flu, pertussis this year. We made sure that everybody in the schools had information about pertussis and watching to be sure that if there were any cases, that we were very aware that we needed to watch for that. Lice is always an interesting topic. Nobody much wants to talk about it or see it. And we don't have a terrible time with that, but we're always on alert. Obesity and nutrition, of course, go together, and then immunization surveillance, which Amy helps us with all the time. A lot of these issues are similar to what the intern presented in her paper. Mental health issues really are something that I think have increased over the period of time that I've been at Radnor, and that's about 12 years now. We have our share of children who have emotional issues, eating disorders, attention deficit, depression, anxiety, panic disorder, drug and alcohol use and abuse, cutting and suicide attempts are those that are most prevalent, believe it or not, at our school. I can say that we handle these not only through our nurses, but we have pretty intense emotional support and behavioral support programs at the school. Students with special needs, we really have programs, a continuum of services and programs for students with special needs, both physical and emotional, and oftentimes they present with unique issues and problems that we deal with. So basically, just school nurses are the first line of intervention in addressing a student's immediate health care needs, and I don't know what I would do without my nurses. They're mine, and I'm so glad to have them. And that's about all. If you have any questions, we'd be happy to answer them.
One thing I wanted to ask is how much do you think this kind of information informs the health curriculum, or is a lot of that sort of state dictated? And obviously, a lot of these issues, especially in terms of the self-care, nutrition, sleep, mental health, a lot of these, one would hope, would be dealt with not only by you dealing with the individual students, but more in the group way by the required time that kids spend in health education. Do you feel that you have much impact on what's taught in health ed, or does that seem sort of like that comes from somewhere else and maybe isn't always meshing with what you're seeing?
I know that the wellness teachers at the elementary level address most of these issues, and they have a state, I believe it's a state mandated curriculum that they follow, and they do address safety issues, nutritional issues, health issues, hygiene issues, and things like that. So, but I would say it probably is separate from our job. We are really not involved. It's not a cohesive plan together. I don't know what you said.
And in the high school, their curriculum, the health, PE and health teachers, the ones that teach health, have their set curriculum. What I do is I check with them what they cover. It's just in 10th grade, and it's not enough. I truly don't think it's enough. I would like to see more, but I think that's part of maybe the students that I'm seeing are the students that need the encouragement of what better things they can be doing to help their health. And I think that in trying to do some programs, giving messages over the PA system periodically as information becomes available is a way to do it. And there are other ways to get more information out. But we try to be timely in terms as information comes up. Is making announcements, different trends in weeks or months that would be making announcements on behalf of those issues that arise.
Somewhat along the same lines, I think we've talked a little bit about this before, particularly at the high school and somewhat, and also at the middle school, the youth risk behavior surveys that you've been doing. And I guess the question is, you've partially answered that. You have limited room for expanding on the curriculum, but it seems to me the information that you derive from those surveys and what you see day in and day out should inform part, at least a good part of what we teach our kids, especially with, at the high school with the youth risk behavior surveys. And so my question is, how do we get there so that this information is meaningfully utilized?
There are a couple of things that are going on that will be new for next year. One is that the Pennsylvania Youth Survey will be administered to all 10th graders. And this is a national survey so that we can, a state survey so that we can compare ourselves to the state. There's a new program called Rachel's Challenge that has been begun at the high school level. There's a curriculum review for health and wellness that should be starting within the next year, I believe. And so some of these issues that we're finding out about, some of the results of the surveys will be really looked at as that curriculum is reviewed. In addition, we're working with the staff of the nursing program at Villanova, and they have a very wide program from a four-year program through graduate studies and PhD programs. And what we're hoping is that we'll begin to work with them in a complex way, not that they just come and work with our nurses, but that our nurses and the students, work with us on curriculum, on community health issues, on relationships within the community, on our lower income residents and the kinds of health needs that they have. So we're just in the very initial stages of negotiating with Villanova, but we're hoping that we could do something that's a little bit innovative with them.
This is a question really along the same concept about interactions across different functions. Is there any foundation that is available for interaction with the food service? Because so much of what the children get exposed to in the cafeteria, links to some of the chronic health issues, and then just to learn how to have a healthy life as you move forward. And I know it's a big question and a big issue, but I don't know if there's any foundation that is already there.
We work with, we have a consultant who is a registered dietitian, and she works with our food service people on a regular basis in terms of wellness and the kinds of food that need to be served to the children. And in terms of teaching, in the health curriculum, elementary through high school, there's nutritional instruction that goes on. I also now believe that we are starting in 9th grade. All 9th graders will be taking a course that has to do with health and wellness, and it'll be a course where students will learn proactively about health, about stress, about getting along with other people, about relationships, about getting help when they need it, study skills, sleep. And it's going to be a required course for all 9th graders. So that will start, I'm thinking, next year.
Do you think that's a very robust foundation? Do you think that there is any room there to have discussion about the types of food that are available in the cafeterias? And one thing that I learned recently is that you can now access your child's account online, which I personally found to be quite enlightening. So I think that's a useful tool, and I hope that parents are encouraged to sign up for that, because then you can educate at home as well. But I don't know if there is any possibility in that regard, because you're a powerful voice and so important, and you see the kids, you see the outcome. So
I do say at the elementary level, though, there is room for improvement. Over the past 10 years, I've noticed a significant improvement in the food choices and the nutritional value. They don't sell any kind of chips or fried type foods. Everything's baked. They provide many more salads. They provide more fruit. They have just juice and milk. So it is, like I said, there is room for improvement, but there has been a concerted effort over the years by food service to improve the food quality in the district. And it still can be improved, but it has significantly improved.
And I have to say, I completely agree, because when my son started kindergarten 7 years ago and I looked at the menu, I was like, wow. And just seeing the change in 7 years has been remarkable. So I totally agree with you.
I wanted to say one other thing about food and then something else. I feel like what I notice is that there's still a tremendous amount of sugar in everything, and that sugary stuff is just taken for granted. And I know in my request to food service in past to like not serve Honey Nut Cheerios but regular Cheerios, and certainly something like Pop-Tarts, which have no nutritional value whatsoever, or sugary yogurt as opposed to less sweetened yogurt, we're met with, we can't do it, just a sort of a negative. And I guess kind of along those lines, is there any, which I think is related to nutrition, is linking with any kind of local food producers and making that link about where foods come from, and we're certainly close to lots of farming areas, which I think again sort of all goes together towards healthier and food and more awareness about the choices that you make and the impact that they have.
We may need a personality like Jamie Oliver to come in.
Yeah.
Yeah, I think that that's something that, that we can certainly discuss with Barbara Nissel, who's our consultant, and we have 2 food service representatives who are really very intensely looking at the foods that the children eat. Where foods come from, and specifically whether or not we can do any kind of direct instruction, around lunch or with the nurses. I think it's something we can look at.
But that might also be something to sort of ask the Villanova students to help with, since they might have the time to actually track, and it'd be an interesting challenge for them to actually track down, okay, if we're, if we want to buy these kinds of foods, where's the nearest local place to, get them, and how would we, fit that into the contract that the school district has. And, there are places all over the country that do it, so it's not possible. Takes work to set it up, and they might be a source of labor that has some time to actually figure it out. I wanted to ask about something else also, though. It's about, and you should, part of this is just informational. Is it my imagination that there's less time going to gym and phys ed? And if, I know I've talked about just my experience with the public middle school, that they had gym every other day for half the year, which was like hardly anything, and that I really liked in elementary school that there was an offering of sort of just lifetime, sort of co-ed after school, just all different activities. An option of, it wasn't a specific activity, but you could sign up for this class and have, just whatever was happening, But I feel like ideally every kid should be moving every day. And is there any awareness of, or a way to increase the amount of time that people have physical activity? And also, I guess along with that, kids who have after-school sports, so are getting that time, some way to count that as instead of gym time. Again, that's something that I know some other districts have done, but in Radnor we haven't done that. So
I know the high school has a program. Paul Carson usually runs that, and it's cyclical in terms of what they're doing, whether it's ping pong or some other after school. There are some after school activity program. So for kids that are not signed up for a sport for a particular season, there is some of that activity for them. And then there's a number of them, and I do not know, but I know Paul Carson, he was a PE teacher and health teacher, usually does that. And there is a notification for the students who would be interested, and usually they make an announcement at the gym classes to make them aware of that too. So.
I'm not aware that they decreased the gym time. I know that there was some discussion during the budget process, but looking into the regulations and the mandates, we were not able to do that. So I know that I think things remain the same. There's intramural sports, of course, at the middle school, so I know after school they have the opportunity for that. I'm not positive about the elementary.
The elementary children have gym once a week. They have 5 specials, and gym is one of them, and they have it once a week. They also do, at the elementary level, kindergarten through 3rd grade have true recesses a day. They go out either in the morning and the afternoon for 15 minutes, and then they have their lunchtime recess. And also, as Sue had noted, there is an after-school sports program for the elementary level as well. And one of the gym teachers usually runs it, and it's usually 1 or 2 days a week after school, and children sign up and participate. So I would believe at the elementary level, they do get a fair amount of physical activity during the school day.
Anyone else have?
Just a brief question. I was wondering about access to vending machines in the schools. And have you done any comparison across the 3 academic venues of private schools, public schools, and parochial schools?
We haven't done a comparison that I know of across the different schools. It's not a bad idea, however, but we have really paid a great deal of attention to what is in our vending machines at Radnor. We've changed, I believe, all of the student vending machines and gotten rid of the Coke and the Pepsi and all the sugary drinks. And so now we have juice and milk. So, and the choices, fruit, the choices are much different now. Baked rather than fried, potatoes, potato chips, etc. We're trying to do that in the faculty access areas, but they're a little bit more difficult than the students. So, but with the student vending machines, definitely. I'm not so sure about the public and parochial, but it's something to look at for sure.
I was wondering sort of what you see, if you had to pick a couple of like the most significant challenges, what would you pick? And also, when thinking about this meeting, did you have ideas about specific things you would like from us as a board, of ways that you had thought that we might be able to help or work with you?
Well,
I think one of the things, the challenges that the nurses deal with all the time is that we are so busy in the health office taking care of children on a daily basis that we really don't have as much time as we would like to become more involved in educational activities. On the average, I would say we see about 40 students a day, every day. And so we're quite busy. And so I think there's a level of frustration that we cannot engage as much in educational activities as we would like. And another thing we had mentioned at the end of the presentation, Andrea said, parents are relying more and more every year on the school nurse for primary health care. Mondays are a busy day because we get, the weekend warriors and the kids that don't want to go to school on Monday sent into the health office by their parents. Oh, if you don't feel good, go to the nurse, and they come right off the bus into the office. So we deal with a lot of children. We see a lot of numbers, and I think one of our frustrations has been that it has limited our ability to participate in other kinds of activities that we would like to do, like health fairs and education, and partner maybe with the wellness and gym teachers, but we just, we are overwhelmed sometimes by how many students we see every day. So you want to add to that?
She said that very succinctly. Being at the high school, kids involved in sporting activities on the weekend will sustain injuries, and the parents will ask, well, check it out with your, the school nurse when you go in. Student hit in the head. Check it out with the school nurse on Monday. So you're working with, you're seeing many of these kids on Monday throughout the day for many things that happened over the weekend. And it's talking with the students in the high school and telling them how important when you get hit in a game, you need to tell your parents, so that if you worsen during the the day goes on or in the evening, because a lot of times I've heard students will say to me, well, it didn't hurt at the time, but now I'm having trouble focusing, or I'm really having a headache, or my ankle didn't hurt, but they come in today and it's swollen. So that you're helping the student one-on-one with educating them about advocating for themselves when they are hurt, making sure they include their parent and tell their parent, how they're feeling. So, and I early on when I started at the high school, there were 800 students. Now there's over 1,200. So I used to go to the health classes and do sessions, and go to and as well as to PE classes, and I was able to do more. 1,200 is overwhelming, and to keep up with all their needs. So, thanks.
Are your doors always open? Or do you have health hours, health room hours, except for emergencies?
I would love to
of
have
course?
health hours. In terms of, my door is open, but I do have time for lunch. I take a half hour for lunch, and in the high school, I do close my office down, and I go to lunch on the property, and they seem to know where to find me and call for me. So that the nurse doesn't have the luxury of leaving the property, because everybody's dependent on the nurse being there all the time. But there are no health hours. I would be interested in hours. I think it might be helpful for students in how should you say, you coming right from your home and walking into the nurse's office at 7:30 in the morning. I have kids walking right off the bus in. I'm feeling things aren't addressed at home like they need to be at times. So I know kids can get sick between leaving home and coming to school, and that's understood. But volume-wise, it's interesting that if you had hours, so at 7:30 your day starts, maybe you should open at 8:30, so that's encouraging students and families to initiate at home in the morning before going off to school. Does your child have a cough or cold? What do they need to start their day? And certainly we would pick up as the day goes on, where that leaves off.
Well, I think it's something worth looking at. I think in the real world, none of us can access health care anytime we want to. Except for legitimate emergencies, it would give you time to get more in depth into some of these issues. Some people know I was in a former life director of student health for the Philadelphia School District, and we instituted health hours for all of our school nurses in every school in Philadelphia. And there were some pains initially, but it worked. And it really enabled the nurses to keep on top of things like there were mandated screenings.
And documentation and
Right.
things that you do, you spend much more time. If you're seeing kids all day long, you haven't even gotten to all that. As you completing the phone calls and the things that need to be done to back that all up, the care that you've given.
I want to just answer the question about what I see as pretty important, and the one piece that sometimes is forgotten is the mental health of students. We live in a very, wonderful community with wonderful involved parents who really find education to be really important. There's a lot of pressure on our students to do well, and I see the stress rising and rising and rising. So I think in terms of how you can help us, anything that you can do with the community to inform them about stressors, academic stressors, mental health stressors, what is our community doing about safe and drug-free schools? How involved is the community? How can we help parents understand better how to approach their children? So that really worries me, that the school can't do it all. Although we are willing to reach out and beyond where we are in terms of location. But I guess maybe a discussion about how the community can be more involved. And I know that Radnor Reach is on the agenda, I noticed. And so parents are becoming more involved. But I think maybe we need to help them a little bit more, to understand that the kids really do have a lot of pressures: peer pressure, parent pressure, teacher pressure. Much more so than I think 12 years ago our children had. So
That's an interesting segue, because one of the things we've talked about at several of our previous meetings, and perhaps Dr. Shapego, you can help us to reach the right person, because one of the ways we perceive as enabling us to do that is by having occasional access to the eMinder system. And we need to work with you and whoever else is appropriate within the system to make that happen.
I think our superintendent she's a very hands-on superintendent, and she's very child-oriented, and I think anything that she perceived would help the children, she would help to implement. So our communications director really is the person who would be the person to help us with that, and I certainly could liaison if you wish.
That's Lisa Williamson?
It is.
Yeah.
Yes.
Great, I accept your offer with
Okay.
alacrity.
Yeah,
if
I'd be
not
happy
quicker.
to do that.
Great, so, I mean, we can follow up and talk more about that. And if we have to have a conversation with Dr. Groban, that would be great too. Because I see that as a great tool. I know I read it every week. I have a child in the high school. So, thank you.
Well, we also have the Community Health Bulletin Board on the website, which might be a help as well. But the e-minders they're really good. And I think they reach a lot of parents now, so we're happy with those.
Dr. Ballard.
I was just curious, the mention was made of the Monday morning injuries as well as the illnesses that had occurred in the wee hours of the morning. How much correlation is there between the mandated presence of trainers and/or physicians at the various sports venues communicating back to you all with reports of injuries and so forth?
Sue, I'll let you answer.
I can speak to that as far as the high school goes. The kids are not only participating in their school programs, and during the week you have the trainer available and coordination with the physician through the trainer. That is pretty much covered, but a lot of these kids play for other teams beyond the school teams on the weekends. And so that I think that that's part of what we're seeing are the injuries. As far as the school ones go, the trainer is available at the high school. He comes in at 2:30 and he works through the sport practices and sporting events on campus. And students that are injured do see him. Some kids that may have noticed pain or an injury stemming from practice the day before, a game the night before, follow through. If there's an injury at the game, they recommend for them to see a physician. That's done, and the physician reports back to our trainer, and the trainer then sends a notice to me. If an accident report is needed as a result of that sporting injury, I've communicated with the athletic trainer who I've worked with for several years now since he's come on board, that when there is an injury you have to send somebody out by ambulance, or the parent advise them to go take the student to a doctor to be evaluated, to let me know so I can follow up with that student in school the next day or two and find out what happened as a result of that. Also keeps me in the loop as far as sporting is dealt with. That student also has gym class and being able to inform the gym teacher as well. So I think that we are doing a good job as far as communication.
Thank you. One other question in the high school realm. How much cooperation or communication do you have from the administration as far as getting the mandated, for instance, the 11th grade physical in and completed with the shot record and so forth? I notice in our office they're still dribbling in at this time of year, which seems to defeat some of the idea of giving the school an update on what that student's health is in September when they report. And these are not students from Radnor, of course.
You speak my language. The parents are given the notice, and in the end of 10th grade, like, we send it out in April so that we can catch the students for the coming year when the parents are getting students physicals for camps and that, getting that in there then so they can address that. And a letter goes home explaining the need for this, the state mandates this, and the bulk of them do come in, but there are a lot of stragglers. But we also deal with the fact that their insurance only covers them for, so when their physical's done, usually near the birth date. And so if they usually get theirs done in December, and it's always done around December, that's what we have to wait for. So they're in provisionally, with the communication that it's coming in. And I send notices home. In fact, all the nurses send the notice home in November is the first notice that goes home that we have not received your child's mandated physical. And then January, another notice goes out. And then also in March. And they keep trickling in. And then we wind up with a handful that have not come in. Another thing that happens is that their physical, if they haven't handed in the parent, their physical that we have on board it's not the ideal. We've been allowed to accept that, but the letter that originally went home at the end of 10th grade explains why you want your child to have a physical. The opportunity to speak to your physician about changes in your body, questions and concerns you have as a student, and those changes in your body or health issues you are experiencing, catch up on immunizations. So that the explanation is there. And so I think we deal with some parents who feel it's not always easy to get their child to service. Not that the doctors aren't there and willing to do it, it's just fitting it into their lives. So.
I just want to say that in talking to Mr. Skellinger, the principal of the high school, and some of the athletic people, the children who are doing athletics really are not allowed to start without the proper paperwork. I think that we do have problems getting some of this paperwork in, and we've struggled with trying to get parents to do what they need to do to get those physicals in. But the athletic students or anybody who participates in sports, according to the principal of the high school, absolutely cannot participate if they don't have what they need to have in.
Well, I want to thank the three of you. You actually have one other colleague you haven't introduced us.
I
Yes.
do want to introduce Marcia Webb. Marcia is our really phenomenal assistant. She helps us with all the nursing state reports, et cetera, that are due, and it's not an easy job trying to take care of that for 7,000 students. So Marcia Webb. Yeah. Do you have anything you want to add? You sure? Okay.
Okay, then. Well, thank you very much, and we will follow up. And Dr. Shapego, may I give you this
Absolutely.
before you leave, so we can follow up on that. I hope everyone feels, as I do, that this has been a very productive session.
Opportunity as
well.
Our pleasure. Thank you. And kudos again to Allison Mosier Mills, our intrepid intern. I hope everyone has noticed, as have I, that the great deal of congruence between her list of teen health issues and what we've discussed today. And we will be following up on those as well in a coordinated way. We have two other items. Unfortunately, as Mr. Taltone has noted, Dr. Leader could not be with us. She did prepare, as requested, a draft position paper regarding a Delaware County Department of Health, and that was sent out to all of us, and it is included in our packets. Is there any, at some point, I do want to bring this to a vote so that we can also send this to the township commissioners for their input. Is there any discussion on anything in that position paper?
I'd just like to thank her for a really comprehensive and very thorough document. She summarized very nicely some of the things we've been caterwauling about here for a couple of years. And it certainly is something that needs to be brought up officially, I guess ideally when she's here to do it, but to forward on to the board for at least hearing our opinion on the matter.
Thank you for that. Anybody else? Do we think we should table this for our next meeting when Dr. Leader hopefully will be with us? I mean, it's, among other things, not only did she do a thorough job, but she did a classic one-pager, which I appreciated. We do have a quorum, and we can actually vote on this tonight if we want to. So I'll entertain either a motion to approve it as is in a second, or a motion to table.
I would like to move to vote on it, to approve it tonight.
Is there a second?
I'll second that.
Is there any further discussion?
Only is what would be the action then if we approve it, which I'm all in favor of, but I mean, is there a protocol for what you propose to do with it?
There actually isn't a protocol. What I intended to do is to send this on to the township commissioners for their reaction and any input. I would like to get their support before we go before the Delaware County Council with our recommendations as contained in this position paper, because I think politically, if for no other reason, it would be helpful to have the support of our township commissioners in going to the county council with this. So that would be the process. If we vote on this tonight and it's approved, then I will draft a memo of transmission and circulate that via email and get your input, members of this board, and then following that, send it as promptly as possible on to our township commissioners.
I guess the only thing that I would suggest is maybe appending the League of Women Voters consensus study to this document, just as an annex for the commissioners to review.
Okay, that's a good suggestion, I think.
I think then if we do annex that as a reference, it can be easily accessed. We may want to, wasn't there like a 4-page summary of the study that was done that was commissioned by the Delaware County Council? That's pretty succinct, and these conclusions are drawn from that. So if we do want to put appendices on, then that would be suitable too, I think.
You're referring to the Hopkins study. Sure, yeah, we can do both. Anything further before we vote?
I guess just, I wanted to sort of in support of this say, not only in my work with immunization, but I've also been working on sort of issues around child development and children with special health care needs, and also emergency preparedness. And in all those areas, I mean, the issue of communication among existing entities is just so important, and that's just one of the absolutely main things we're missing by not having a county health department that is a central coordinating body for the communication. You know, just that communications piece is so important.
Absolutely, and I should, for the sake of our viewers, indicate too that Delaware County is a very large county in terms of population, and nevertheless, we are one of the few counties in this area, if not in the whole Commonwealth of Pennsylvania, that does not have its own Department of Public Health to coordinate these issues and do the many things that departments of public health do in other counties. Is there any further discussion on that? Then all in favor? Aye.
Aye.
Any contraries? Congratulations. Thank you. Dr. Genevieve Burns is not here tonight, and she is our liaison to the Environmental Advisory Council. So we will not have a report from her tonight. Amy Wishner is our liaison to Radnor Reach.
Yeah, in fact, maybe one of you knows more about this, but I mean, the only Radnor Reach meeting recently was canceled, so I think in sort of the ideal world, Radnor Reach would be a great thing. In the real world, I'm finding that it's not really doing that much.
Yeah, I haven't heard anything about the rescheduling of the meeting. The first meeting was kind of a discussion, an informal discussion about the issues around the township and safe and drug-free schools. The second one was also scheduled to be informal. I know that the high school is working to try to formalize the process a little bit more, and I think that's up and coming.
Thank you again. So we will look forward to, is there any way we can do any outreach, Amy, to is it two persons who are co-chairs, Elaine Schaefer and Christy Shug? Is there any way we can do any outreach to them and see what, if anything, we can do to nudge them along?
I can certainly contact them again. I mean, I've offered before to help or, you know, in any way. And I don't, anyway, I will follow up with them.
Thank you, and I have also offered my help in whatever way I can, and you can please pass that along. It still stands. Thank you. Is there any new business for tonight's meeting? Hearing none, I'll entertain a motion to adjourn. It's been moved, seconded, and without any demur, we'll adjourn. Thank you.